All right, then. Welcome back. So let's continue our conversations. Theo, you've done some work on this disturbing trend, but how pronounced would you say the access to doctors in the rural areas are or is?
It's quite serious. It's quite serious because in many medical health centers, in many general hospitals, you don't have doctors. I have an experience that, every time I remember that, it's like I should start shedding tears all over again. In 2012, my father needed oxygen. He was in the house and he was gasping for breath. He needed oxygen. The health center, next to my village, there was no nurse there. I went to the general hospital, there was no doctor. And even when I got the doctor, I called him, please, he said, look, you're talking about oxygen. You are joking. We can't get any oxygen here unless you take him to somewhere, maybe Makurdi or Lokoja, maybe to get oxygen.
Meanwhile, time is of the essence.
Of course, he lost his life that day. We lost him that day because there was no help. It's as serious. And I was 2012. It's worse than, that today. I will look at various data that we have. Nigeria, if you look at maternal health, Nigeria is worst in the world. 10% of maternal deaths globally is in Nigeria. That means that women who don't have access to the kind of medical care they need, maybe before, during, or immediately after childbearing. It's 10% globally.
These things
today.
are avoidable.
And these are avoidable. These common, midwives can help, nurses can help, but they don't have access to midwives and nurses. And I want us to be very clear-minded about this. When you talk about healthcare, it mustn't be gigantic hospitals that politicians build and commission with fanfare. We need, even if the hospitals are not really big, let there be equipment for investigation. Yeah. Because some persons may just have headache, and then you start treating them for typhoid because there's no proper investigation.
So it brings to mind misdiagnosis and so on.
Of course, and that is one of the causes of death in Nigeria. At times somebody will be treated for maybe cancer in Nigeria. By the time he gets to maybe Europe or even Middle East countries, they'll say, no, you don't have cancer. What you have is maybe one pain in one part of your tumor. They administer a kind of treatment, and then that's it.
Just like Ghanaian Fahmy was being treated for pneumonia and he had cancer. Until his daughter came to take him to the US. By the time he got to the US, they discovered that the level of remission was already a big problem. And that was how the man died.
So I think we should emphasize investigation and quality medical personnel, because as long as we don't have medical doctors in rural areas, people will just keep dying. And we shouldn't say that Nigeria's population is too much so people can die. No, it shouldn't.
Yeah, because Theo, India comes to mind, 1.3 billion people.
Yes.
And Nigerians prefer to go there.
Sir, India has one doctor to 1,000 persons. In India, one doctor to 1,000.
They met the...
So they meet the world standard. One doctor to 1,000. But in Nigeria, you're having, 24,000 to 216 million. If you look at that, one doctor is treating about 10,000 persons in this country. Yes. It doesn't work. Even if you go to Philippines, if you look at migration of doctors from their home countries to UK or to Europe, you see Philippines is highest, but Philippines has one doctor to 1,000 patients. India is second.
Medical colleges are turning out doctors.
Yes, sir. India has one doctor to 1,000. So if you go to India, it doesn't. It's not difficult to train a doctor in India.
Yeah.
But in Nigeria, things are made difficult. Things are made so difficult. There are no equipment. The political will is not even there. People have to struggle through. And you see, we need to ramp up. The number of doctors we train in Nigeria and make deliberate effort to retain them. Yes. If we don't make deliberate attempts to retain them, we'll continue to have this problem.
It will get worse.
Every medical doctor wants to fly out.
All right.